Patrick's respiratory symptoms include COPD and dyspnea. These are likely to have been caused by his long-term smoking habit of 40 years, due to the fact that smoking is one of the main contributing factors of COPD, either emphysema or chronic bronchitis. COPD is an incapacitating and progressive disease which results in difficulty breathing due to the narrowing of the airways and weakened lung tissue. Common symptoms of COPD include shortness of breath or difficulty breathing on exertion, a chronic cough with phlegm, wheezing, and recurring chest infections. Dyspnea causes the breathing rate to increase, therefore individuals have trouble breathing. As a result, individuals tend to use their accessory muscles for breathing because much more effort is required to expand the chest during the process of inhaling and exhaling. Emphysema generally occurs when there has been long-term damage to the alveoli within the lungs due to cigarette smoking or other air pollutants. The destruction of the alveoli results in the disintegration of the alveolar walls, which creates a larger sac as opposed to many smaller ones. This results in decreased oxygen perfusion within the capillaries and in turn inhibits the expulsion of carbon dioxide, resulting in difficulty breathing. Chronic bronchitis occurs when there is excessive mucus production due to airway inflammation, which results in a recurrent mucus-producing cough. This evidently compromises one's ability to breathe. Chronic bronchitis can be a result of smoking or other inhalation of other harmful air pollutants. Patrick's tachycardic heart rate is likely to have been caused due to his smoking history, left-sided heart failure, and being considered clinically severely overweight according to his BMI of 29.3. Long-term smoking habits have a tendency to result in tachycardia. Smoking has numerous negative chemical effects on the body. As nicotine is inhaled, it enters the bloodstream rapidly, crossing the blood-brain barrier, and eventually reaches the central nervous system. It acts as a stimulant, which causes the body to release adrenaline as a mechanism of the sympathetic nervous system. The release of adrenaline and catecholamines results in an increased heart rate and increased blood pressure. This mechanism also results in vasoconstriction, which increases cardiac workload. Another contributing factor to Patrick's tachycardia is his diagnosis of left-sided heart failure. Left-sided heart failure compromises the heart's ability to pump blood effectively around the body to essential organs. The heart subsequently uses a compensatory mechanism with increased contractility. Increased contractility can cause irregular or abnormal heart rhythms. Additionally, Patrick's increased body weight would also be a contributing factor to his increased heart rate. This is due to the fact that being overweight can have detrimental effects on normal heart function. Excess body weight can result in increased cardiac workload due to an increased strain on the heart to pump enough blood and oxygen to muscles. This excess fat causes a burden on the muscles, thus resulting into a higher heart rate during the performance of physical activity. Patrick's COPD and left-sided heart failure can both result in dyspnea, especially on exertion. COPD causes difficulty in exhalation due to lung damage from either smoking or other air pollutants. Heart failure generally develops due to the ventricles becoming stiff and not being able to fill properly in between beats. In certain cases, the heart muscle may be compromised and weakened, resulting in dilation of ventricles. This results in ineffective contractility. When an individual is suffering from left-sided heart failure, the heart is unable to effectively pump blood to the rest of the body's vital organs. In addition, physical activity generally causes an individual's heart rate to increase. This results in increased cardiac workload due to the fact that the heart must pump blood at a faster rate to meet the increased blood flow demands caused by exercise. However, if the heart is not able to pump blood at a faster rate, it causes blood to be trapped within the lungs. This results in fluid retention and shortness of breath due to excess mucus in the lungs. Furthermore, left-sided heart failure is generally caused by coronary artery disease or high blood pressure and is not considered to be directly linked to COPD. However, the two diseases may have influences on each other. For example, decreased oxygen levels in the blood caused by COPD would cause extra strain on the heart, which would in turn worsen left-sided heart failure. Excess fluid in the lungs caused by heart failure may cause difficulty breathing, especially for individuals with COPD. Patrick is now at an increased risk of developing right-sided heart failure due to left-sided heart failure being the leading cause of right-sided heart failure. In Patrick's case, the left ventricle is unable to effectively pump blood, which causes pressure to accumulate within the left side of the heart. When the left ventricle fails, there is an increased fluid pressure which gets transported back into the lungs. This results in the damaging of the right side of the heart. When the right side of the heart loses contractility, blood travels back through the body's veins. Therefore, blood accumulates within the left ventricle, which leads into the left atrium, followed by the lungs, and finally into the right ventricle. It makes it extremely difficult for the right ventricle to transport oxygen-poor blood through the pulmonary valve and into the lungs. This results into failure of the right ventricle, therefore causing blood to further accumulate within the extremities, which results in peripheral edema and swelling of the liver as well as other organs. It is evident from Patrick's test results that he has many abnormalities present within his blood. His sodium levels are abnormal as it is 150 millimoles per litre, which is greater than the reference range of 135 to 145. This is associated with the condition of hyponatremia, which is an electrolyte imbalance. The cause of his potential hyponatremia is linked with dehydration due to fluid loss, which might be associated with edema, as Patrick's case outlines that his legs are swollen from the knee down, which means that there is excess fluid within the legs. The presence of high sodium levels can be harmful on neurological function as it causes the alterations within the natural electrical currents of the nerves. Patrick's potassium levels are also abnormal as it is 5.2 millimoles per litre, which is greater than the reference range of 3.5 to 5 millimoles per litre, which is also linked with dehydration. Dehydration and edema are clinically linked due to the fact that when an individual is dehydrated, their body goes into a water starvation mode and tries to retain as much fluid as possible, resulting in edema. High potassium levels can affect neurological function as it can interfere with the functioning of the nerves and muscle cells. Patrick's blood test results have also displayed abnormal levels of calcium as it was 2.05 millimoles per litre, which is lower than the reference range of 2.15 to 2.6. This may indicate that Patrick could potentially have a vitamin D deficiency as it's associated with low calcium levels or low calcium intake. Calcium is related to neurological function as it is required for cell signaling. Additionally, Patrick's blood test results display lower levels of hemoglobin as it is 101 grams per litre, which is lower than the reference range of less than 130 grams per litre. Hemoglobin is linked with anemia, which is a decrease in red blood cells. A lack of hemoglobin causes many problems within the neurological function as it impacts the cognition function, causes dizziness, lack of concentration, and lightheadedness. Patrick has abnormally high LDL levels of 3.5 millimoles per litre compared to the reference range of less than 2. This is triggered by Patrick's history of smoking, his large waist circumference, and his high blood pressure, as all these factors can contribute to higher LDL levels. LDL is related to neurological function as it causes a buildup of amyloid plaque within the brain, which results from high levels of bad cholesterol. This has been associated with the development of Alzheimer's disease, which is also linked with dementia. Furthermore, Patrick's blood test results also display that he is lacking HDL, which is a good cholesterol, as it is low at 0.8 millimoles per litre when compared to the reference range of more than 1.0. Low HDL might potentially be associated with Patrick's history of smoking, as the chemical within cigarettes decreases HDL levels. Additionally, being overweight and having high glucose levels are some of the contributing factors of decreased HDL levels. HDL is essential for the neurological function as it aids by protecting the nerve cells, which is necessary for communication between the brain and the body. He's also suffering from high levels of triglycerides of 4.2 millimoles per litre, which is greater than the reference of less than 2. Patrick may have potential metabolic syndrome as it is associated with reduced HDL, which is good cholesterol, high glucose levels, and a large waist circumference. Triglycerides and low HDL levels are related to neurological function as they are the cause of mild to moderate depression. Lastly, Patrick's glucose levels are abnormal as it is 8.5 millimoles per litre, which is higher than the reference range of less than 6.1. Having high glucose levels within the blood means that Patrick may develop diabetes. High glucose levels are linked with neurological function because it can lead to abnormalities within the small blood vessels located in the brain. This can impact the white matter within the brain. An additional blood test that may have been required for Patrick would be an albumin test. Albumin is a protein created by the liver which prevents fluid leakage from blood vessels, nourishes tissues, and is used as a transportation device for hormones, medicines, and other substances. His albumin levels are likely to be abnormally high due to his current potassium and sodium levels, which may be due to dehydration from his edema, which is caused due to water loss that is stored at the legs. Elevated levels also may be present due to a loss of fluids. Moreover, an individual's blood plasma tends to be more concentrated in an individual who is dehydrated.